Welcome to the Simulation Lab. I'm going to tell you about the features of the simulator as well as the location of equipment and supplies in the room. The simulator you use today may look different than the one I'm using for demonstration. The features of the simulator are consistent throughout the lab. The simulator has the ability to sweat, to cry, the eyes react to light, he can leak blood or cerebral spinal fluid from the ears. The tongue can swell to mimic an anaphylactic reaction. The simulator can be intubated and have a cricothyrotomy performed. He has an extensive library of heart, lung, and bowel sounds to mimic many different illnesses. He can have unilateral or bilateral chest rise. He can have a needle decompression or chest tube placement performed. He can also have a Foley catheter placed for urinary output. The simulator has the ability to seize. IM injections can be placed in the left deltoid. He has blood pressures in the left arm. He has carotid, femoral, brachial, radial, popliteal, dorsalis pedis, and posterior tibialis pulses. We ask that you do not place paper or ink near the simulator, as these items can transpose onto the skin. Your scenario today may include a patient monitor. If so, it is found here. Your scenario may include a crash cart. If it does, you will find the defibrillator on top of the crash cart. This defibrillator is live, so safety is strongly encouraged. There is a pin light also available on top of the cart. The first drawer of the cart contains IV fluids. The second drawer contains medications. The third drawer contains IV and injection supplies. The fourth drawer contains suction supplies. The fifth drawer contains airway management supplies. And the sixth drawer contains a bag valve mask as well as a Foley catheter kit. All the drawers are clearly labeled for your scenario. We recommend that you assign team roles before beginning your simulation if these have not already been predetermined. Some examples of team roles include team leader, vital signs, medication administration / interventions, EHR, scribe, and history and physical. Most of these roles are clearly defined. There are a couple that are a little confusing in simulation. If you are assigned as the scribe, we ask that you take notes on paper or the whiteboard that is provided in the room. If you are assigned to the EHR role, you will obtain information about the patient from the electronic health record and advise your team. These roles may be adjusted or combined based on the number of members within your team. We ask that you treat the simulator as you would any patient. The patient will answer questions regarding present illness and past medical history unless they are unconscious or otherwise unable to communicate based upon their current illness. Please use proper hand washing before beginning your exam. If you are unable to find a supply or medication to treat your patient in the room, simply state what treatment you would like to provide and your patient will respond accordingly. If you order labs or special tests, they will either be handed in the room to you or displayed on the patient monitor. Please verbalize any treatments or medications given to the patient so that the staff and faculty observing the simulation are up to date on the interventions being provided. We ask that you do not stand in front of the window in the simulation lab. We want to ensure that the operations specialist has a clear view of the simulation at all times. We understand that participating in simulation can be stressful. Studies show us that mistakes made here improve patient safety and care in the future. Mistakes are treated as puzzles to be solved, not crimes to be punished. We operate under the Vegas principle here. Confidentiality is expected. Please be professional, polite, respectful, and curious about others' actions and remarks. We hope that you enjoy your simulation experience today.